Hi, I'm Dr. Beth Livengood, medical consultant with Yahweh Yoga and one of their teachers in the RYT 200 and 500 hour programs. I'm also a yoga instructor and a licensed naturopathic doctor in Phoenix, Arizona. We're talking today about cholesterol. What do you do if you have high cholesterol but you don't yet need medication or don't want to take what was prescribed? There are some things you can do. Chances are, if you've had high cholesterol on one or two of your lab results, you've probably been given a prescription for a statin. This is the most commonly prescribed drug in the United States. And while it is beneficial in certain cases, it is not without its side effects. Side effects can include muscle weakness, fatigue, erectile dysfunction, and memory loss. So what else can you do besides taking a prescription? Well, the first thing to do is to get moving. Exercise helps us to metabolize fats and carbohydrates before they even have an opportunity to turn into cholesterol. Exercise is especially good at increasing HDL, which is your good cholesterol, and reducing triglycerides. Interestingly, moderate to high intensity exercise also increases oxidized LDL, which makes sense because exercise is a stressor to the body, and this is how we get stronger. But it also makes sense to take an antioxidant after heavy exercise in order to reduce those stressors in your blood and also to improve the elasticity of your blood vessels. Antioxidants are found mostly in dark-skinned berries, but also vegetables and other fruits. So you can get it in your diet or you can take a supplement. The next thing to do then is to get a more complete picture of your lipid profile. So beyond the standardized total cholesterol, HDL, and LDL, there are specialized lab tests that give you a much better picture of what exactly are your lipids looking like. So here are a few examples. The oxidized LDL, the one that increases after you exercise, is a marker of the quality of fats and carbohydrates in your diet. So if you're eating a paleo diet, but you're having poor quality meats in abundance, this marker will actually be high. It's a marker for atherosclerosis. So this would tell us that it's important to improve the quality of the foods that you're getting in your diet. Small dense LDL is a snapshot of the quantity of carbs in your diet, especially in the last 3 to 4 months. Having a high level of small dense LDL makes damage on the walls of your arteries. So we would know that in this case, we need to reduce the amount of carbs and fats in your diet. Apolipoproteins are genetic markers. Some of them are beneficial and protective, but others are risk factors for Alzheimer's, dementia, and cardiovascular disease. The good news is that genes are not written in stone, and our diet and our lifestyle directly affects which genes get turned on and which ones get turned off. Knowing this information about your genes will further help you target your efforts towards the treatment that you need to improve your health. Once you have a more complete picture of what your lipid profile is, the next step is to fine-tune your diet to reflect those results. So if your LDL is high, then you want to improve your liver function by increasing bitter greens, vegetables, and fiber in your diet. Whole grains are also beneficial because they contain fiber and nutrients, and seeds and nuts are helpful because they contain essential fatty acids. All of these will help your liver function better. It's also important to reduce saturated fats and sugar if your LDL is high. If triglycerides are high, you can actually increase the tannic foods in your diet. These are things like grapes with the skins on and the seeds in them, cocoa, and even a little red wine. It's helpful to increase fish oil in this case as well. And of course, reducing simple carbohydrates is also helpful here. So adding in yoga, such as a power yoga or flow yoga, can be really helpful to raise your HDL, along with something like high-intensity interval training. Of course, find a doctor who's knowledgeable about these specialized tests and also about diet and lifestyle changes that can support your efforts towards reducing the risks found in those tests. This is even more important if you have other conditions going on, such as diabetes, heart disease, or obesity. A naturopathic doctor can also guide you in incorporating herbs and therapeutic doses of vitamins into your regimen. Know that we're here for you. You may contact me at drlivengood@yahwehyoga.com or visit my website, drelizabethlivengood.com. I'm seeing patients in person in Phoenix, Arizona, or via telemedicine anywhere in the world.